Welcome to Simply Women's Health with CJ. I'm your host, CJ. I've created this channel as a place for you, the healthcare consumer, to come to get reliable information about the female reproductive system. These videos are in no way meant to replace a visit with your healthcare provider, rather as a place for you to come to get information that maybe will help you figure out what questions to ask at your next visit to best optimize your healthcare needs. If you feel as though these videos have been helpful, I would love it if you would subscribe and or like. If you know somebody who you think might benefit from this information, please don't hesitate to share these videos. I appreciate any and all support you can give. That being said, let's go ahead and get started. Hello. Today we're going to talk about the intrauterine device, or the IUD. A couple of different kinds of IUDs on the market, both hormonal as well as non-hormonal. Today we're going to focus on the non-hormonal intrauterine device. There's really only one product on the market. It is called Paragard. Paragard is a plastic T. It is wrapped in copper. It looks like this, although it is white, it is not blue. We think that the IUD works by setting up an inflammatory response within the uterus, and the copper changes the pH of the cervical mucus, making it hostile to sperm. With this device, you still ovulate, you still menstruate, you still do everything the same. You just decrease your risk of getting pregnant by 99.6%. Notice I did not say 100. The only way that I can absolutely promise you that you will not get pregnant is if you don't have sex or you become a lesbian. Otherwise, if the penis and the vagina are in the same room, there is always a chance. When we put the IUD in, there's risks: infection, bleeding, pain. There's a very small risk for uterine perforation, where the provider can go through your uterus, put this out into your abdominal cavity, requiring you to go to the operating room to get it taken out. It's very, very rare, but it can happen. If you have decided that Paragard is the product for you, your provider will probably ask you to abstain from unprotected sex for 2 weeks prior to your IUD insertion. Most of my patients, I will recommend that they take some kind of pain reliever an hour before their appointment time, whatever they use when they have cramps, just because it is a somewhat crampy procedure. You'll go into the office. They will want to do a pregnancy test. They will counsel you, and then you will sign a consent giving them permission to put the IUD in. After all the paperwork is done, you'll get on the table. They will put your feet up in the stirrups. Your provider will put a speculum into your vagina. They will open it up and they will find your cervix. Once they have found your cervix, they're going to clean it off with a little bit of betadine. If you are allergic to shellfish, iodine, anything in the iodine family, you would want to let your provider know that. After they clean off your cervix, they are going to measure the depth of your uterus with a little sound. This is a little plastic tube, and it's got markers on it to show different centimeters. They will put that in. That goes all the way up into the top of the uterus to measure how deep your uterus is. Not going to lie, that part is somewhat uncomfortable, which is why I usually have you take something before you come in. After they have measured the depth of your uterus, your provider is going to put the applicator up into your uterus. They will expel the device into your uterus, pull back, come out, and then they will trim the strings and take the speculum out. After the IUD is in place, I usually recommend to my patients that they not put anything into their vagina for the next 7 days. I want to give those IUD strings a chance to soften up. The Paragard strings are relatively soft, and then after they've had a week to mix up with the cervical mucus, they have the consistency of a dental floss. I recommend, if you are having pain that is not managed by ibuprofen or Tylenol, if you are bleeding heavy enough to saturate a pad in an hour, if you are running a fever, if you have foul-smelling vaginal discharge, you do need to contact your provider. After the week is over and you and your partner resume intercourse, if he says that he can feel the strings, I usually tell my patients I don't really care if he can feel strings. However, if he feels something hard hitting him that feels like a plastic edge, that is something that we would be concerned that you might have expelled your device. 2% of women will spontaneously expel their device. It doesn't happen very often, but it can happen. This does not mean you need to go to the emergency room. You need to stop what you're doing. Don't go to the emergency room, but you do need to make an appointment with your provider. They'll probably want to do an ultrasound, make sure that IUD is at the top of the uterus where it belongs. once a month after you have your menstrual cycles. And keep in mind, your menstrual cycles for the first 3 months are going to be a lot heavier and a lot more uncomfortable than they typically are. After 3 months, those menstrual cycles typically return to baseline. Now, if you're a person who already has painful, heavy menstrual cycles, this may not be the best product for you. Once a month after you have your menstrual cycles, somebody put their fingers up in there, feel for those little strings. I don't want you to measure them. You don't need to, I don't want you to pull on them, nothing like that. Just make sure that they are there. If you can't find your strings, you may want to make an appointment to be seen. You can go in, your provider can put a speculum in and make sure that those strings are where they belong. Again, this device is good for 10 years. If you feel as though it's a good option for you, I recommend you talk to your provider about that. That's all I have for today. This is CJ. I'm at your cervix.